Question 125. General features of cranial nerves. We have 12 cranial nerves. The olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibular cochlear, glossopharyngeal, vagus, accessory, and hypoglossal. They are in pair, so it's one on each side. They supply the head and neck, and the vagus nerve also supply the organs of the thorax and abdomen. Firstly, the first cranial nerve, olfactory nerve. You can see here more descriptive. It goes straight forward and it is the nerve of smell. Then you have the optic nerve, which crosses through the optic chiasm, so when it goes out here it goes across there. And it is the nerve of sight. Then you have the oculomotor nerve. Here you have pons, oculomotor nerve. Now it's in orange. These are the muscles that it controls. The muscles of the eyeballs, except for those two. And it also has parasympathetic fibers for smooth muscles of eyeball, like the sphincter pupillae and ciliaris muscle. The trochlear nerve gives motor fibers for obliquus bulbi superior, number 4, superior oblique muscle. Then we have trigeminal, which is number 5. It gives sensory fibers to the skin of the face, mucosa of nasal and oral cavity, including palate, teeth, tongue, salivary glands. And it gives motor fibers for masticatory muscles. Next we have abducent nerve, which give muscle fibers for rectus bulbi lateralis, lateral rectus muscle. Next we have facial nerve. It gives muscle fibers for facial expression. It has parasympathetic fibers for lacrimal gland, submandibular and sublingual salivary glands, and it receives sensory fibers or gustatory fibers from ventral 2/3 of the tongue. Next we have vestibulocochlear nerve. It is number 8. And this one is sensory fibers for equilibrium and hearing. Next we have glossopharyngeal nerve. It has muscle fibers for muscles of pharynx and soft palate. See here, soft palate, there's pharynx. It has sensory fibers for mucosa of pharynx and root of tongue, and gustatory fibers from the root of the tongue. And it has parasympathetic fibers for the parotid gland and pharyngeal mucus glands. Next we have vagus nerve, number 10. It has muscle fibers for voluntary muscles of the pharynx, larynx, and esophagus. It has sensory fibers for mucosa of pharynx, larynx and esophagus, and also mucosa of digestive and respiratory tracts. It gives parasympathetic fibers to the heart, to smooth muscles and mucous glands of digestive and respiratory systems, smooth muscles of abdominal part of urinary system, and to testes and ovaries, parasympathetic fibers. Next we have accessory nerve. It gives muscle fibers for sternocleidomastoid muscle and trapezius muscle. Lastly, we have hypoglossal nerve. Gives motor fibers for muscles of tongue. And lastly, look at how they exit the skull. Firstly, the olfactory nerve goes through the foramina of cubriform plate. The optic nerve goes through the optic canal. The oculomotor nerve goes through the superior orbital fissure. The trochlear nerve also goes through the superior orbital fissure. The ophthalmic nerve also goes through superior orbital fissure. The maxillary nerve goes through the foramen rotundum. Mandibular nerve goes through the foramen ovale. Now the ophthalmic, maxillary and mandibular nerves are the branches of trigeminal cranial nerve. The abducent nerve goes through superior orbital fissure. The facial nerve goes through internal acoustic meatus. Here. As does vestibular cochlear nerve, also through internal acoustic meatus. The glossopharyngeal nerve goes through jugular foramen. The vagus nerve also goes through the jugular foramen. The accessory nerve goes through jugular foramen. And hypoglossal nerve goes through hypoglossal canal.